November is National Home Care and Hospice Month, and this is a good time to bring awareness to the important functions of these services. Kyleigh Rollins and Debby Taylor, both registered nurses with Baptist Home Health and Hospice, are here with us to share some information and give us some advice about these two important services. Ladies, so great seeing you. Good morning.
Thank you for having us.
Of course. Okay, Debby, let's talk home health. Explain how the service helps patients, and then who qualifies for home health.
Okay. Baptist Home Health brings health care directly to the patient within their own living area, whether it be their home or if they're living with another family member or in assisted living. And we have nurses and therapists, social workers and aides who come into the home to provide those services and to help that patient reach the best possible outcome. Well, some of the services that we provide are IV infusions, wound care, post-op rehab. Patients who have had strokes recently may require all of those services to regain their independence and become fully functional again, or learn to adapt within their home. And to qualify for those services, you have to have a qualifying diagnosis and a skilled need. And you can talk to your primary care physician about that, and they can determine if you meet those qualifications. You can also call our office at 501-202-7882, and we have nurses there that can talk to you to help you figure out if you would qualify and maybe connect you with that physician to make those arrangements.
Okay, and then Kyleigh, let's talk more about hospice. So explain what is hospice, and then how does it differ from home health, and then who qualifies for hospice care?
Sure. So hospice is end-of-life care. It's comprehensive and captures the physical, spiritual, psychosocial, emotional needs of a patient and their families to make sure that they're getting what they need throughout this journey. And we walk this journey with them. Our primary is symptom management, whether that be pain, anxiety, whatever that may be for this patient, shortness of breath. We are there to kind of help guide this family in their care. It's done in the home as well. That can be a facility like a nursing home, an assisted living, or their actual home. The difference in home health and hospice is home health is geared to promote that independence and regain that strength, whereas hospice is there to guide that journey, knowing that a patient is likely going to expire. Qualifying factors for hospice, there's the biggest thing that we have to say is that a patient would pass within 6 months or less if their disease progressed as we expect it to. We are there to guide that entire process and to help make that determination with the PCP, with the specialist, with the referring partner to make sure that this patient's getting what they need for whatever time they have left.
Okay, and then Debby, how far across around the state does Baptist Health serve patients with these services?
Okay, so our hospice and our supportive care services cover a 50-mile radius from Little Rock and Arkadelphia. And for home health services, we have agencies in Heber Springs, Little Rock, and Arkadelphia who cover a 50-mile radius and beyond.
I know you've worked with a lot of patients. How has this helped them, or what have they told you of how this has helped them?
One of the things that they find so helpful and they're so grateful for is that they're able to stay in their home and receive these services. And the things that we do are to help promote the independence and help them regain independence, whether that's fully functional as they were prior to their illness or their injury, or we help them to modify their activity and their home so that they can continue to live in the home and be independent in some factor.
Okay, and then Kyleigh, I know that there are plenty of job opportunities with these services as well. So talk more about that aspect of things.
So we have nursing needs. I know that's an issue nationwide. However, our staff is very, very special. It takes a special person to go into a patient's home and learn to adapt to their environment, and also to learn to love them where they're at, and be able to care for them. And you develop a very deep and lasting bond with these patients and their families. You know, you're getting to see the more personal side of them being in their own environment. Nursing is is always, always something we're looking for as we grow and expand all of our agencies. CNAs are great. Those ladies and men, they see these patients more than our nurses do, and it's just a great service for those patients to be able to get the care that they need, the extra little TLC. Those are our biggest needs, and those are our biggest hurdles.
Sure.
But we would love to discuss any opportunities with anyone who might be interested.
Well, if someone is watching and is interested, what would be the best way to reach out to y'all?
The best way to call would be 501-202-7474 for hospice, and 501-202, you're going to have to help me, Debbie, with the home health number.
7480.
I'm sure we have it on the screen, too.
And you really could reach either of us at either of those phone numbers. And then we also have a website, www.bhhhn.com, where we also have jobs listed. Or if someone needs information on how to obtain home health, hospice, or supportive care services.
Okay, great information. Ladies, thank you so much for joining me
Thank
today.
you for having us.